ఓకే దెన్. సో మనం ఇప్పుడు గౌట్ గౌట్ గురించి మాట్లాడుతున్నాము. సో వీఆర్ గోయింగ్ టు టాక్ అబౌట్ ద గౌట్. ఓకే, సో ఫస్ట్ ఆఫ్ ఆల్ see how they are going to test us in the examination. Okay, now there are simple only one MCQ they are asking. Okay, as last time in FMG 2025 what they asked about the colchicine. What is that? Colchicine ka mechanism of action. Okay, they asked this one. Okay, so what is the MO of colchicine? Actually this is the WBC na. WBC only responsible for the inflammation, isn't it? So WBC it will move with the help of microtubule. So colchicine is going to inhibit this formation. So what happened? WBC vehicle will be damaged. So WBC cannot move. So it cannot going to move to. So WBC now. So if the vehicle microtubule is damaged, then it is unable to move toward the joints. So it will decrease the risk of whatever your gout. Okay. So this is what they asked in the examination. See actually. See here, if they ask you what is the drug of choice for the gout in a acute case. Acute means sudden, there is sudden rise. Okay, see for these cases guys, we have to the drug of choice is your NSAID. First of all you go with the NSAID. Okay. Drug of choice is the NSAID. What NSAID? Example indomethacin, okay, ibuprofen, etc. But you have to avoid the aspirin and the PCM. Avoid the aspirin and PCM because PCM has poor anti-inflammatory property, isn't it? Okay, and you have to avoid the aspirin also. I will tell later about that one, like what are the drugs causing the gout also. Okay, so the first step is you have to give the NSAIDs. If it fails, then you have to give the colchicine. I already told you what is the mechanism of action of this colchicine. Okay, so next one here, if in the resistant case of the colchicine also, then you have to give the corticosteroids. Corticosteroids is the drug of choice. Okay, so as you know that NSAIDs are very very nephrotoxic. So you have to avoid in the renal failure patients. Okay, then what is the drug of choice in the renal failure patients? You can give the colchicine. Okay, colchicine, or also you can give the corticosteroids also, no problem. Got it? Yeah. So if anyone asks you what is the treatment of acute gout, colchicine, indomethacin. Okay, done. No more mistakes. Next one. From here they are going to ask you many questions. Okay, simply if I tell here, what is this one? Yeah, I will tell you. Simply here, mechanism of action. Wait. Here see MOV here. Okay, this is the WBC now. WBC in the inflammation, what happens? WBC will move now. It will move toward the joints and etc. Then that's only it will causes the arthritis. Okay na. So what if, so this is microtubules, it's like a vehicle for the WBC. So what happens, when you are going to damage the microtubule, that is vehicle for the WBC, does WBC will move? No, it's not going to move. Then it's not going to do the your arthritis formation. Got it? It's very simple. Next one. So here this is the best one. See here. Yeah, for the gout. So this is the hypoxanthine. What is hypoxanthine? It is a shift of purine metabolism. It is a shift of purine metabolism. So purine metabolism, okay na? So hypoxanthine have to secrete in the urine. How it's going to secrete? Hypoxanthine first it will goes to liver, and liver, okay, liver it will convert it into uric acid, okay. So in liver, by what enzyme? Xanthine oxidase enzyme. Xanthine oxidase enzyme, okay na? It will converts hypoxanthine to uric acid by what enzyme? Xanthine oxidase, okay. Then later on uric acid will be excreted in the urine, okay. Got it? Very good. Next one here, see here. So in the case of gout, there is a increase uric acid, okay now. So our main target is to decrease the uric acid production. See here, what happens when you are going to decrease this? You are going to inhibit the xanthine oxidase enzyme. If you are going to inhibit the xanthine oxidase enzyme, does hypoxanthine is going to convert into uric acid? No, isn't it? So that's why the drug is the xanthine oxidase inhibitors. Xanthine oxidase inhibitors. Example, your allopurinol. See, purinol, oxypurinol. So these are the synthetic, okay. These are the synthetic. These are the man-made drugs. So it will going to inhibit this one. It will going to inhibit this by competitively, okay na? By competitive inhibitors. It's like a by they are going to inhibit the xanthine oxidase by competitive, okay, like competitive. But about the febuxostat, okay, it's a non-competitive, okay na, because there is no pyrinol here. Just no need to remember, just in for the exam purpose. What are the, they will ask you, a patient is on febuxostat, a patient is on allopurinol. What is the MOA of this drug? It is a xanthine oxidase inhibitor. That's it. This is your purpose, okay na? Yeah, that's it. Only remember this one. That's it. So got it. So sometimes they will ask you which of the following drugs can result in the decrease in the production of uric acid. The answer should be allopurinol, oxypurinol, febuxostat. That's how they are going to ask you in the exam, okay. So so next one here. So here next one, see, it's very simple. See here uric acid is not a water soluble. It's not a water soluble, okay. So that's why actually this is allantoin. Whenever you are in intermediate, okay, intermediate, actually you heard this word allantoin. Allantoin is a shit of bird, I think so, okay na. This is the bird. It is a water soluble. Actually in the birds, uric acid is going to convert into allantoin. Allantoin is a water soluble, so it will be easily removed from the body, okay, in birds. But in humans, uric acid is not going to convert into allantoin. That's why birds will not get gout, okay. So our main target is that we have to convert the uric acid into allantoin, okay. That's why it is a uric acid oxidase enzyme inhibitors. See here, for the conversion of uric acid to allantoin, you will require the enzyme called as uric acid oxidase enzyme, which convert into allantoin. So allantoin is a water soluble and it is easily excreted out from the body. So that's why see is a uric acid oxidase. It is a pegloticase, rasburicase. See it is extracted from the mammals, and this one is from the birds, okay now. So it's a pegloticase, rasburicase. So these are the injections given. These are oral form, these are injections. Okay, na? In the C. Got it? So they will ask the mechanism of action. MOE is very important. Got it? Next one. Next one. Here. This is the uricosuric. Uricosuric means what, amma? It will excrete the uric acid into the urine by inhibiting the transporters called as OATP and urate. Just remember this one. Uricosuric. They will ask you example probenicid. It is a, what is the mechanism of action? It is a uricosuric agent. Just remember this one. Okay. So how the questions they frame, I already told you about this one, guys. See, what is the uricosuric agent? It is a probenicid and lesinurad. Okay, na? See, these groups of drugs, they are less commonly used nowadays because it causes the uric acid stone formation. But after this first like acute gout treatment, we have to start with this one, xanthine oxidase inhibitors. After this, if it is resistant to this one, you have to start with this one, pegloticase or rasburicase. Okay, so got it. So this is the main drugs we have to remember. So one thing remember here, so I will tell you one thing here. Yeah, don't mind my handwriting. Okay, see here, drugs causing gout, drugs causing gout and drugs which are safe in gout patient. Just take note, gout patient. Okay, safer, not safe in. Example, your see, example, your pant is mnemonic, PANT, pant. Just take note. P for paragenamide. It is an anti-TB drug. A for aspirin, low dose. N for your niacin. T for thiazide loop diuretics. These causes your automa. These are responsible for the gout. Okay, these causes gout. And coming to this one, which are good for the gout is, your mnemonic is false, FALSC. Okay, F for what, amma? It's a phenofibrate. A for aspirin, high dose. L for losartan. SC for what? Statins. Okay, I will leave it once again. Drugs which are responsible for the gout is are, example, PANT. P for paragenamide, S for aspirin low dose, N for niacin, T for thiazides and loop diuretics. Coming to this one, which are good for gout, these are your false: phenofibrates, aspirin high dose, your losartan and statins. Okay, got it? That's it. If you have any doubts, let me know. అర్థమైంది కదా? అర్థమైందా? It's okay, no problem. So it's just a recording. Got it, huh? Okay, guys.